नमस्ते विवेक जी, थैंक यू सो मच फॉर सच अ वार्म इंट्रोडक्शन। और आज तो वर्ल्ड कैंसर डे है, तो आई एम ग्रेटफुल कि आपने मेरे को ये अपॉर्चुनिटी दी टू कम एंड टॉक अबाउट पेशेंट एडवोकेसी। सो थैंक यू वेरी मच। सो मैं आप सबके साथ एक प्रेजेंटेशन शेयर करूंगी एंड आई विल टॉक अबाउट cancer advocacy in across the world, its changing face, the impact it has brought in, and how are we managing cancer advocacy in India. तो विवेक जी, मैं शुरू करूं? I will share
जी
my
प्लीज
screen.
प्लीज।
जी, I'll just share my screen. Screen, am I visible? Is the screen
जी जी
visible,
जी
विवेक जी?
फुल स्क्रीन कर लीजिए जी।
फुल स्क्रीन कर लेती हूँ। या एक मिनट। ओके, एक मिनट। अभी दिख रहा है विवेक जी?
जी फुल स्क्रीन तो नहीं आ पाया है।
अभी
हाँ जी
अभी आ
बिल्कुल।
गया ना?
यस यस।
जी, ठीक है। तो इससे पहले मैं ये शुरू करती हूँ। सो आई जस्ट वांट टू टेल एवरीवन अबाउट हु आई एम। मेरा नाम वंदना महाजन है और मैं कैंसर केयर एंड पैलिएटिव केयर काउंसलर। आई एम अ वेरी वेरी पैशनेट पेशेंट एडवोकेट। इतनी पैशनेट हूँ कि आज फैमिली में शादी है लेकिन मैं फिर भी यहाँ पे आई हूँ। सो दैट इज द रोल ऑफ अ पेशेंट एडवोकेट. I am also someone who has the lived experience of cancer. So I relate very closely to cancer struggles. So when I was diagnosed with cancer, I did not have the support that me and my family needed. तो बहुत जरूरी है कि we need talk about the importance of advocacy in a family that has been affected by cancer. I did not get the emotional support. I had excellent doctors, but I did not have the emotional support. No one was there to guide my daughter about what to do. Nobody was there to support my husband. Nobody was there to tell me that what to expect. And post-treatment, survivorship support bhi nahi mila. That is when I decided that I need to step into this area and talk about and do something that will support the cancer community. So मैं अपने presentation शुरू करती हूँ. So let's talk about advocacy in cancer care. सबसे पहले we need to understand what is cancer advocacy. So the latest statement by WHO, जो अभी 2 दिन पहले release हुई है, it says by 2050, the cancer burden is going to increase by 77%. My God, that's scary, 77%. And अगर अभी हमने कुछ नहीं किया, तो कब करेंगे? So the cancer community worldwide actually believes that till हम सब मिलके we pitch in, we support the cause of cancer in various ways. जैसे विवेक जी ने बोला था, not only treatment, but also care, quality of life. So वो कैसे कर सकते हैं? उसमें then, the role of advocacy comes in. What is advocacy? Advocacy, समझने के लिए, I'm just going to take you through certain points. Advocacy plays a pivotal role in cancer control planning and is necessary in any resource setting to influence policy and improve delivery of cancer control. The WHO 2008 Practical Guide on Cancer Control Policy and Advocacy and 2013 to 2020 Action Plan for the Prevention and Control of NCDs, Non-Communicable Disease, जिसमें कैंसर भी आता है, both articulate that advocacy is a critical strategy in improving cancer control and care delivery, not only nationally, but internationally. Definition of cancer advocacy is very varied, but in cancer care, we define advocacy as a systemic approach to promoting cancer-related issue and motivating others to take action. Now, cancer patient advocate का काम क्या है? This advocacy provides a framework to ensure meaningful involvement of the community in decision-making that affects the lives of the patients and the caregivers. It is recognized that cancer advocacy provides a voice for the patient and raises awareness of their needs. What is the most important concept of patient advocacy? ये सब तो बहुत definitions मैंने बताई आपको. It is rooted very deep in the concept of empowerment. When we talk of empowerment, we mean that we involve patients and the caregivers. We encourage them rather in participating in their own care. So I basically told you what is patient advocacy. How can advocacy happen? For any advocacy to happen, we need people who are called patient advocates. This slide that I'm showing you is very, self-explanatory. Different roles of a patient advocate. So what does a patient advocate do? A patient advocate supports a cause or policy regarding cancer. कहाँ काम करते हैं? They work on local and national levels. What do? They provide support to those living with cancer or those who have lived with cancer. They also provide support to people who have lost their lives to cancer और उनकी जो families रह जाती हैं. Raising awareness about the disease, advancing cancer research, very, very important, improving the quality of cancer care, and addressing legislative and regulatory issues that affect cancer care and research. Now, we've spoken about what is cancer advocacy, patient advocacy. Usko karne ke liye patient advocates chahiye. So what do they do? So basically, patient advocates, they act as a bridge or a liaison between patients, family members, the research community, and the clinicians. So sochiye kitna important role hai for the right information to reach the different stakeholders. Therefore, we need to strengthen patient advocacy. So what do? They support, newly diagnosed patients. They engage in fundraising activities for cancer research. They also sit on government review panels. They educate the local community about the different, advancements or availability of cancer treatment. They provide resources like transportation, accommodation. They moderate social media sessions like Vivek ji is doing, in collaboration with CRSF and with UTSA. They raise awareness about cancer events and advancements. Now, we have patient advocates. When patient advocates come together, then we form patient advocacy groups. So, अकेले तो कोई कुछ नहीं कर सकता. Therefore, there is strength in togetherness. Therefore, we need patient advocates to come together and form advocacy groups. What is the role of patient advocacy? So as per the NCCN, which means National Comprehensive Cancer Network guidelines, patient advocacies help patient families and their caregivers to navigate the complex cancer landscape. These groups ensure patients receive appropriate, timely care, education, financial assistance, emotional assistance, psychological assistance when needed. जब हम high income countries की बात करते हैं, cancer advocacies have been a potent influence in raising awareness about cancer burden and directing public and private efforts towards cancer control. Unfortunately, in countries like India and different LMIC countries, matlab low and medium income countries, where cancer somehow abhi bhi low priority hai, advocacy is very, very underdeveloped. We need to prioritize cancer control because, like I said right in the beginning, by 2050, WHO says the cancer cases are going to rise up by an alarming 77%. So basically, that is why we need more patient advocacy groups to bring public's concern to the policymakers. जब तक policymakers के पास हमारे concerns नहीं पहुंचेंगे, we cannot bring about the much needed change. Now, there are different types of cancer advocacies in the world. This picture tells you about many. There is educational advocacy, which of course, talks about educating people and raising awareness. Then there is political advocacy, which is very, very important. Involvement of the government in approving and supporting the various concerns and bring about the much needed change is very, very important. So that's the political advocacy. Research advocacy, ये शुरू में विवेक जी ने भी हमसे बात किया है. Research advocacy में, at the support groups, they raise money for cancer research. They support cancer research through clinical trials. Then support advocacy. It improves the quality of cancer care. When we talk of cancer care, remember, like Vivek ji said right in the beginning, it's not only about treatment. It is about end of life. It is about survivorship. It is about pain relief. It is delivery of care during treatment. It is about psychosocial support. So support advocacy ka role ye hota hai. There is fundraising advocacy, which helps raise funds for various causes. Community outreach advocacy is very, very important. So I'll talk about this later. Ab India mein, ye to maine advocacies across the world ki baat ki hai. Now, what are the various cancer advocacies in India? We have educational advocacies. We have support advocacies. We have fundraising advocacies. In areas mein bahut sari support groups, patients individually, bahut sari NGOs, hospitals, they are doing a lot of work. So let me just cite some examples. For example, Capid India. Capid India is doing some amazing work for cervical cancer. We have Can Kids. Can Kids is doing some exceptional work for supporting cancer in children. I'm a part of Lung Connect India Foundation. We are supporting cancer patients pan-India and even in our neighboring countries through different advocacies, which includes treatment, emotional support, reaching out to the government. And then we have Indian National Congress, the Indian Cancer Society, which is doing some amazing, amazing work. So in areas mein, there's a lot of work that's happening in our country. But kaha kami hai? We need more advocacy for cancer research and clinical trials. I recently attended a conference which was done by NIHR, National Institute of Health and Care. Inka bahut kaam hai towards advocacy in NCDs, which includes cancer as well. And political advocacy needs stronger, more emphasis, community outreach programs. Now, impact of cancer advocacies in the last decade. There's been a lot of impact. This slide to aapki information ke liye hai. So in 2017, Cancer Resolution, the Global Action on NCDs, WHO cost-effective recommendations for NCDs, and Sustainable Development Goals are global health commitments that are interconnected, building on each other to provide countries and other stakeholders with a framework to deliver and develop comprehensive cancer services. So, there is improvement in quality of life because of the various treatment modalities, survivorship. There are people survive for a longer time. So, post-surviving, there is emphasis on improving the quality of life. There is there are emphasis on prioritizing cost-effective interventions. There is emphasis on integrating the cancer advocacy in the NCD plans, and also so alongside research investment, cancer advocacy efforts have helped improve detection, survival, and for some cancers, even cure. अब हम बात करते हैं that areas that need stronger advocacy. Caregivers ke liye, we still don't have enough support in our country. So we need stronger advocacy for caregiving, for talking about the high cost of cancer, survivorship issues ke liye advocacy hai hi nahi. I am as a survivor, I still don't find the support that I need. Nobody talks about the long-term side effects of the treatment. Where is the advocacy for that? And palliative care. There is hardly any advocacy for palliative care. We are taking baby steps. We still have a long way to go. Communication and public policy. Public policy advocacy is much needed in our country. Stigmas. What are the challenges to advocacy in India? Simple, one line. Stigma and the myths attached to cancer. इससे ज्यादा तो कोई बड़ा hurdle है ही नहीं. As we all know that cancer is still considered a disease of the untouchables. So if we start from there, it prevents people from reaching out for treatment. They reach out to alternative treatment and they lose their lives. So unko how can we convince them to be a part of advocacy when they are not ready to acknowledge their own struggles? Therefore, this is the biggest stigma. Then we have knowledge gaps. We have limited organizational capacity and resources. Kis liye? Because India is a huge country with different, people culturally, we are all very different. How do we collaborate and bring them together? Lack of funding. And like in the beginning, Vivek ji said, we do not want to collaborate. I don't know why we don't want to collaborate. Till we collaborate, we cannot strengthen the cause of patient advocacy. How can we build a stronger ecosystem to support cancer patients in India? बहुत जरूरी है. Yeah. Number one, educational advocacy. We need more organizations. We need more support groups. We need the government to step in. We need hospitals and doctors to step in to do this. If ये खुद ही slide काफी explain कर रही है. Then we need political advocacy. Then we need research advocacy to ensure high quality research that is sensitive to the priorities of cancer patients. This may mean more targeted therapies that offer higher quality of life and fewer and easier treatment visits. Support advocacy, जो मैंने पहले भी बात किया है, fundraising advocacy. I want to pay a little extra time on community outreach advocacy.
Vandana ji, if we can wrap up fast.
Ji, this is the last slide, Vivek ji. This advocacy is very important to reach out to the community in a manner that encourages a two-way dialogue. Therefore, we need to have a two-way conversation with the community. Therefore, community outreach advocacy is very important. Why be an advocate? This is my last slide. Unless people like you care an awful lot, nothing is going to get better. I'm telling you, nothing is going to get better. So thank you very much.